Hello, this is Nelton Tobias, a medical student at KSMU Core, and today I'll be talking about schizophrenia. On the introduction, schizophrenia is a mental disorder affecting cognition, emotion, and perception, and it's characterized by positive, negative, and cognitive symptoms. So the word schizophrenia is a combination of Greek words such as "schizein", which means spirit, and "phren", which means mind. So generally, it's splitted mind. The exact cause of schizophrenia is not known, but it has been linked to multi-factors, such as genetic factors, such as family history of schizophrenia, biological factors, such as head injury and epilepsy, antenatal factors, such as exposure to Haemophilus influenza virus, to a pregnant woman who is in her second trimester. It predisposes the child who is going to be born to be predisposed to schizophrenia. Also, demographic factors such as high parental age and gender. So, in the part of gender, schizophrenia tends to start early in males. Also, social status such as low socioeconomic status, although this has led to like controversy, like does schizophrenia affect those people with low socioeconomic status, or those with high socioeconomic status are the ones who got schizophrenia, then they drifted into low socioeconomic status. So there is a theory called the downward drift theory. On the pathophysiology, uh, there is a dopamine hypothesis whereby there is a decreased level of dopamine activity in certain neural tracts, such as prefrontal cortex, and this is responsible for negative symptoms. And also, there is an increased activity in certain neuronal tracts, such as mesolimbic pathway, and this is linked to positive symptoms. Uh, all this theory's evidence comes from the treatment, whereby most of the antipsychotics are successful in treatment of schizophrenia. They are dopamine receptor antagonists, and in addition, cocaine and amphetamines increase dopamine activity and cause schizophrenic symptoms. So that was the evidence for this dopamine hypothesis, whereby there is a increased dopamine activity in certain neuronal activity, but also there is a decreased activities of a certain neuronal pathway, mm, leading to negative and positive symptoms. The clinical presentation of schizophrenia includes three parts. Part A is there is positive symptoms, part B is negative symptoms, and C is cognitive symptoms. So the positive symptoms, these are the ones which comes from increased dopamine activity in the mesolimbic dopaminergic pathway. So this includes perceptual disturbances like hallucination, mainly auditory hallucination is seen in schizophrenic patients, and other uh, symptoms such as delusions. On the negative symptoms, these are the ones which results due to decreased dopaminergic activity in the prefrontal cortex. So it includes apathy, alogia, which is a poverty of speech, anhedonia, in which is uh, the patient is mainly the patient here lacks pressure in pleasurable activity, that is anhedonia, but also affects And the patient with schizophrenia have flat or blunt affect. They don't laugh to jokes. And C, these are cognitive symptoms such as impaired attention and impaired working memory, so which leads to forgetfulness. So in order to diagnose schizophrenia, we use DSM-5 criteria, in which the patient should have positive symptoms, negative symptoms, and the symptoms should be causing clinically significant distress or impairment in functioning for a period of 6 months or more. The treatment of schizophrenia is a multimodal approach whereby both therapy and medications are used. So psychoeducation, which involves educating the patient about the illness, the causes, the risk factors, things like that, and also how to cope with the disease, because schizophrenia tends to be chronic and lifelong. But also antipsychotics are used, such as typical or first-generation antipsychotics, which are effective for positive symptoms. Example, haloperidol, fluphenazine, and chlorpromazine are used. And here you should monitor the extrapyramidal side effects, such as Parkinsonism. But also atypical, which are second-generation antipsychotics, are used. These are effective for both positive and negative symptoms because they act on both receptors, the D2 receptors and 5-HT receptors, which are for serotonin. Example of this medication includes risperidone, clozapine, and olanzapine. So here in the first or the second generation antipsychotics, you should monitor metabolic syndrome, side effects, and hyperprolactinemia. That marks the end of our presentation. And these are my references. This is Sakati and Wasa is Sakati, exercise books. And thank you for watching this video. And please subscribe to my YouTube channel for more videos like this. Bye, have a good day.